Hi.
Hi, do you have an appointment?
I don't, but my name is Mrs. Tootie, and I've seen Dr. Sausage Fingers before, and I was in the grocery store, and I was getting really dizzy, and so I wanted to see if she had anything available.
Okay, let me check her schedule. Actually, she has a break in her schedule right now, so let me give her a call, make sure that's okay.
Okay.
Mrs. Tootie, oh, hi.
Hi.
It's good to see you again.
Good to see you too.
We're gonna come this way.
Okay.
And you can have a seat right here.
Okay.
So, what brings you in today?
Well, so I was over at the grocery store, like right next door, and I was starting to get really dizzy and lightheaded, and so I thought I'd come and stop by.
And did you fall at all at the grocery store?
Mm-mm.
Okay, well that's good. I'm happy that you came by. That sounds like a pretty important thing going on with you. So you're gonna get up here and we're just going to take your blood pressure and heart rate and see if anything's going on.
Okay.
So I'm just gonna put this on your arm. So I found that your blood pressure was 220 over 130, which is very concerning to me. So we're just gonna run a couple more tests. I'm gonna take this off. And I'm gonna have you actually stand up real quick and see what happens. Oh, is anything going on?
I'm kind of dizzy.
Okay, we're gonna sit back down. And then I'm just gonna check your eyes real quick. Okay, so I'm kind of worried about you. I'm gonna go check in with your doctor and see what's going on and if he'd like to see you before we continue anything. So I'm gonna have Miss Cuge and Miss Tattle come in and they're gonna kind of run some more tests for me while I talk to your doctor.
Okay.
I'll be back in a second.
Okay.
My milkshake brings all the boys to the yard, and they're like, it's better than yours. Damn right, it's better than yours. I could teach you, but I have to charge. My milkshake brings all the boys.
Hello?
Hi, Miss Dr. Bombastic.
Yes, how may I help you?
It's Dr. Sausage Fingers over at Elite Physical Therapy. And I was just calling about one of your patients, Mrs. Tootie. She came in with some dizziness and nausea, and I checked her blood pressure and it was 220 over 130. So I just was seeing if you've put her on any medication that wasn't showing on her chart, or if anything was going on with that.
Well, you know, after the past couple of years, she has been developing some heart issues, so I did prescribe her some nitroglycerin last year, though I don't know if she's been using it because she has not been coming into my clinic recently.
Okay, well, I just wanted to let you know what was going on with her because she just came in, she was at the grocery store and was feeling this and came to the clinic today. So would you like me to stop therapy and send her back to your office and you can see her, or?
Well, do you think it's serious?
I would say that blood pressure of 220 over 130 is pretty serious.
Well, was there anything else that you observed that might make you think that she needs to come see me? I'm awfully busy.
She had some nystagmus, and then when we went from sit to stand, she got pretty dizzy and had some orthostatic hypotension.
Well, yes, that does sound like an emergency. Why don't you call my secretary and we'll get her on the schedule later today.
Okay, perfect. I'll have your secretary call Mrs. Tootie and they can figure that all out.
Hi.
Oh, Miss Tootie, how are you?
Good.
All right, so today, well, I'm pretty busy, so we're gonna have to try to speed this up. But you were having some trouble, so you ended up here, and I was told to do something, and I'm trying to fit you in your schedule, so we're gonna try to hurry it up, and we want to get you on the treadmill. So hopefully you don't have any questions because we gotta go. All right?
Okay.
All right. So can you point to where you're at on that scale?
I think like a 13.
13. Okay, that doesn't sound like you're working hard enough, so we're gonna actually have to speed that up. So hold on. All right, so how are you feeling right now?
Not good.
Not good? Does your heart hurt? All right, we're gonna stop this. You go get the chair right now. Wow, it really looks like you're breathing heavy. Is that the first time you've worked out in quite some time? Okay, well, that didn't help me a lot. What about your pain? Is your pain in your heart? Heart. Okay, well, that means you better go get, you said you were on nitroglycerin, so we're going to get that to her fast. Great, thanks. Hold this. You'll feel better in no time. Just relax. I'm going to go check my Facebook.
How's everything going over here, guys?
Yeah, everything's been going
Well,
great. Everything's been going great.
Oh, okay. Well, if everything's going good, I'm gonna go finish scheduling my last patient.
Yeah, we don't need you here.
Oh, okay. Well, I'll be right back, Mrs. Tootie. Thank you so much.
Mhm.
Mrs. Tootie, thank you so much for coming in. I'll see you next week. Don't forget to check up with your doctor, and have a good rest of your day.
Thank you.
Thank you so much.
You're not gonna believe what Miss Cooch had her do.
What?
She made her run 100 miles per hour on the treadmill and gave her nitro.
What? Are you kidding me?
No.
Oh no. This is right, Dr. Big Shot, we have a situation. Miss Cooch gave Miss Tootie, one of the patients, nitro while she was doing exercise on the treadmill. And I need some help on what to do. I don't really know how to handle this.
Did she physically put it in her
She
mouth?
physically put it in her mouth.
We may have a legal situation.
Okay,
This is what I need you to do. You need to call their doctor immediately.
okay,
Document everything.
we'll do.
Get all of your notes in order because we may have an issue here.
Okay. Do I need to do anything for Miss Tattle, who was in the room with Miss Cooch?
Well, that's another issue altogether.
Yeah.
Let's table that one and call the doctor,
Okay,
and we'll start there.
okay. I'll come back and see you after I call him.
The boys are away. My milkshake brings all the boys to the yard, and they're like, it's better than yours. Damn right, it's better than yours. I could teach you.
Hello?
Dr. Bombastic,
Yes?
it's Dr. Sausage Fingers from Elite Physical Therapy. I just wanted to let you know of an incident that happened at our clinic with one of your patients, Miss Tootie.
Incident? That sounds bad.
Yeah, it's pretty bad. Our PTA, Miss Cooch,
What's a PTA?
it's a physical therapist assistant. They're trained in helping us out with exercises and some other smaller things that I look over and watch over.
Oh, so you supervise them?
Yes.
Ah.
Yes, I do. So while I was out of the room, Miss Cooge was having Miss Tootie do a treadmill test, and she had some angina, and Miss Cooge fed Miss Tootie the nitroglycerin.
Are physical therapists allowed to give medications to patients?
No, we are not, and neither are PTAs.
Well, sounds like you got a hell of a legal situation on your hands. I
Yeah.
bet she's gonna sue the pants off you.
Wow. I really hope not. I think that we're going to take all legal precautions as necessary.
Well, I think I'll handle it here. After all, I am a real doctor.
Yeah.
All right, bye-bye then.
Oh, okay. Goodbye. Talked to her doctor. He was not happy. He was pretty pissed off, actually. But he's putting it in his notes. We're handling that. But I also wanted to let you know that Miss Cooge was not the one to bring this to my attention. Miss Tattle, the tech, was. Not very good on her part that she was not going to be honest about that. So I think something needs to happen with her.
I think you're handling this the right way. Let's
Okay.
bring both of them in here, and you and I will counsel them together.
Okay, sounds good.
So I think you both know why I brought you here today. We're going to discuss the issue that happened with Miss Tootie. Would you like to begin by telling me what happened?
It was pretty much like a normal day in the clinic. I don't know what she has to say, but nothing really happened that I thought was a big deal.
Well, she did give her nitro in her mouth.
No, I was not the one to give it to her. You were the one that went to get. No, you went to get it for her.
That's
And
what
so-
you told me
and-
to. So I
no.
was listening to directions.
I don't think that's how it went.
Yeah, and then you just left her and you went to go get on Facebook after she was really having some chest pain.
Yeah, I got a couple notifications, but I was watching the patient the entire time.
I mean,
You're being
Seriously?
ridiculous. Yeah, it was fine. The patient survived, didn't she?
I feel pretty
We'll call
confident.
Miss-
You know, I've heard about enough. I can handle out of you two. I do believe Miss Tattle is telling the truth. Miss Cooge, you're fired.
Screw this!